Today we're talking about knee decompression. It's a great therapy that's been introduced to the practice. Dr. Wyatt, take it away.
So knee decompression, it's actually a lower extremity decompression. We can use it for the hip and for the knee. What's great about it is we get to isolate the knee joint and or the hip joint. And so one of the key factors about knee pain and specifically knee dysfunction is we lose the full extension device. There's something called a screw home mechanism. That is the first thing that kind of disappears with any type of knee pain or dysfunction.
So are you talking about meniscus or ligamentous tears, or we're...
Correct. So when we don't have that full extension mechanism in place, the synovial fluid's not being replenished. It's basically, our knee is a pressure decompression compression device that actually pulls blood across the synovial membrane. That's actually what restores the synovial fluid, and that's what heals and brings nutrients into the joint capsule, the meniscus itself, and the ligament structures. If that is missing, then we don't get an optimal healing response. So a simple tear in the meniscus can turn into a surgical event, and once we go invade that joint capsule, it can be a big challenge. So this device specifically creates a decompressed state at the joint itself. It allows it, then it compresses back and then decompresses again. We do that for about 5 minutes.
So you're getting that pumping of the fluid.
We are creating an artificial pump, and it helps us to reestablish the extension mechanism. And what we see is typically about 90% of the patients stand up after the treatment and have an immediate response. They typically have a significant reduction in pain. And sometimes they don't even feel like their knee's there anymore, which is a critical factor.
How long does it take? And then how often do we typically do
So
this?
5 minutes is a typical treatment plan per visit, and we're seeing you 2 to 3 times a week, and we may do that for 4 to 6 weeks.
Okay. Well, if you're having knee pain, a great place to start, rather than jumping into MRI and all the other things. Give this a shot, and it may just restore all that function that you're looking for.